Okay, fluid and electrolytes part 2. We're going to talk about the hyper and the hypo. And again, I just tried to put together funny little scenarios to help us remember which goes to what, and the way to treat them, and the causes, and the signs and symptoms, and the nursing interventions. First, let's talk about hyponatremia. We just need to remember that there's two different kinds of hyponatremia. There's hyponatremia from sodium loss, and there's hyponatremia from too much water, so it's going to be too diluted, so it's not going to know it has enough sodium in there. The one from sodium loss, well, you're going to be, often that's from your renal failure, your renal loss, or your GI loss. And you need to remember, if you have a decrease in sodium, wherever salt goes, water follows, but if you have a decrease in sodium, you're going to have a decrease in weight. So you're going to have decrease in sodium, decrease in weight. Probably, since it's from GI loss, you're going to have nausea and vomiting. You've thrown up so much now your mucous membranes are dry. You need to be really careful that you don't have seizures if you become extremely hyponatremic and go into a coma. The way you're going to treat that kind of loss is you're going to replace those fluids. They're going to have decreased sodium, so they're going to have, they're not going to have enough fluids, so you're going to have to reinflate those fluids. So you're going to have to give them fluids and electrolytes, and you're going to have to do it slowly so you don't prevent neurodamage. You don't just want to poof it up and then just flush it in there real quick, because that's just going to send them into shock. If your hyponatremia is too watered down from so much water, what's going to happen if you're all bloated? You're going to gain weight. So that's going to be your biggest indicator again. So if you gain weight, you're going to be all bloated, you're going to not feel good, you're going to have a headache from being all bloated, I guess. You bloat up your head, I don't know. But anyway, and then you're going to have increased blood pressure. And for those people, you want to treat it differently, because you don't want to replace their fluids. They already got fluid overload. So you're going to have to pull back some of those fluids. So you're going to be on fluid restriction. And so you have to be real careful with those. Those patients for hyponatremia, those are caused by CHF. Maybe they had too much hypotonic solution in their IV. So, they had too much hypotonic, so it was, it just watered it down. They didn't have enough sodium concentration in there. Your potassium, let's talk about your potassium. That's the 3.5 to 5. And your hyperkalemia is your impaired renal function, or can cause this, is also your decreased renal excretion of potassium can cause this. So, the signs and symptoms of too much potassium, you're going to be your diarrhea and your anxiety. You're going to have, you need to remember that if it's more than 8, well, those papers, that can indicate cardiac arrest. So too much, potassium can be real dangerous. Well, what do you want to do if you have too much potassium? Obviously, you're going to want to eliminate some of that potassium. So you might use diuretics. You're going to tell them to not eat potassium-enriched foods. You're going to maybe offset that decreased potassium by giving them calcium gluconate, and kind of fool them into balancing each other out. Your nursing management, you're going to treat your symptoms. If they have diarrhea and if they're anxious, you're going to treat that. They might have muscle weakness, so you might need to assess for that. You're going to tell them to avoid things like bananas, because they don't need more potassium. They need to have less potassium. So they're going to avoid their bananas and their meats and their dark green leafy vegetables. Okay. Your hypokalemia is not enough potassium. So with those patients, you're going to have your nausea and vomiting. Oh, and back it up. On hypercalcemia, you're going to have diarrhea. That's going to be your telltale sign. With hypo, you're going to have nausea and vomiting. So that's a big difference between the two. Both of them, you might have paresthesias and EKG changes. But hypokalemia, nausea, vomiting; hyper, diarrhea. These people need to put more potassium in their diet, but you're never going to exceed it past 60. You're going to never give it IM or IV push. You're going to give it in a bag at a slow rate, not more than 60, and you're going to really dilute it. If they have hypokalemia, tell them to eat those bananas and those meats and those dark green leafy vegetables. You might also have an EKG ordered and monitor that as well. Okay. Calcium, we're going to talk about hyper and hypo. Here's a good scenario to remember both of those. This one, let's talk about Big Kathy with a C. My name's spelled with a K, but anyway, let's talk about Big Kathy with a C. Big Kathy with a C. Well, I'm always tired, never get enough sleep, so confused. I'm having memory loss issues, can't remember this crap. It's really hard. I wish I had anorexia so I would be skinnier. What are you going to do for me? Well, you're going to give me diuretics, so maybe I won't be so big, because I am Big Kathy with a C. You're going to pull off some of that weight for me, so you're going to give me a loop diuretic. Well, you're going to tell me that I need to not drink so much milk because milk has more calories in it, that I just need to drink water. So there's step number one. You're going to, if you're going to give me fluids, you're going to give me watered fluids. So you're going to give me isotonic fluids, your kind of neutral fluids. So you're going to say no milk, more fluids. If you're giving IV fluids, you're going to give it with like your normal saline, your D5NS, your 0.9. You're going to tell me that I need to move around and get that calcium deposit mineralizing, which is going to stimulate, by moving around, it's going to stimulate my nerves, which calcium's important for, which is going to hopefully stimulate the nerves all the way up to my brain and stimulate my memory to help my memory improve. So there's how you're going to help big old Kathy. Now, how about little old Kathy? Well, she's opposite of Kathy. So little old Kathy, she's a drunk. She's drank too much alcohol. She has pancreatitis. Because I drank too much alcohol, I got decreased calcium. I've been thin my whole life because I've abused alcohol, and I've abused laxatives, which is going to make me hypocalcemic. I've also had multiple blood transfusions because when I was drunk I had a car wreck and lost a lot of blood. So that may have caused it too. Little Kathy, well, she always has face twitch, which, you know what sign that is? That's that Trushuk sign. Your Kreschek sign, however you say that. Your CHVOSTEK, I think is how I got it written down here. You also need to pray for little Kathy that she raises her hand up to the Lord because she needs His help. So when you put that blood pressure on, that blood pressure cuff, and the hand raises up, that's that Truo sign. So poor little old Kathy, she needs to raise her hand up. She's always got that face twitching. She may have tetany. Because she's going to have that decreased calcium, which is good for your teeth and bones, she's going to have brittle nails. So what are we going to do for Kathy? She's a mess. So what we're going to tell Kathy is, well, we're going to say, first of all, we're never going to give it IM because it can cause skin sloughing. But instead we're going to give her oral supplements of calcium. We're going to counsel her and tell her to quit drinking. We're going to tell her to drink more milk instead of alcohol because that'll help with her brittle nails. She may have abnormal clotting factors too, so just keep that in mind. But again, she had that blood transfusion from that accident, so she's got some issues with her blood anyway. So we may end up giving her calcium gluconate, and we're going to tell her to put more calcium in her diet. We're going to tell her to go take a vacation, get away from the drinks and the alcohol, go to the beach, eat more fish, and eat more sardines, and then she can have some tulip greens to go along with that. Okay, we're also going to teach her about alcohol cessation, and tell her she needs to get off the booze. All right. Phosphorus. Phosphorus is 2.5 to 4.5. Well, it's essential for muscle function. Well, let's talk first about big ol' Phil, or hyperphosphatemia. Well, big ol' Phil, let me think how I said that before. Big ol' Phil, he's big. He drank a lot of milk his days. So yeah, big ol' Phil drank a lot of milk. He has excessive milk. He's big. He has hypothyroidism. His thyroid doesn't act right. So he's just all kind of out of whack. But so what we're going to do to him is we might need to eliminate some of that Phil's phosphate. So take that out. So we need to correct that with phosphate hydration and phosphate binding agents. And phosphate and calcium kind of work together, so we might tell him to take a calcium supplement. And you're just going to have to remember phosphate and calcium work together. So since we need him to have more phosphate in his diet, to have less phosphate in his diet, we might need to tell him to take a calcium supplement. And we're going to teach him about his diet again, and we're going to watch for signs of hypocalcemia. So because they kind of work in conjunction with each other. Your hypophosphatemia, which is your little Phil. Well, little Phil, he's malnutritioned. He's also an alcoholic, just like Kathy. He's Kathy's cousin. They got a real messed up family. But anyway, he has, this is signs that he has often with alcohol withdrawal. It's very common. It's also common in patients that if they've worked out in the yard and they've sweated and they had heat strokes, we're going to encourage oral supplements. We're going to encourage dairy again, because your phosphate and your calcium work together. So anyway, we're going to encourage that dairy. And with those signs, because you need to keep hypophil, he's malnutrition, he's that alcoholic, he's not going to have enough, or he's going to have inadequate phosphatemia, or he's going to have not enough phosphorus. So he's going to be confused, which is often how alcoholics are. They're confused. He may have anemia, and he may have muscle weakness and pain. Your hypermagnesemia, well, I was thinking, what was I thinking with this one? Your big Maggie. Your big Maggie is your renal failure patients. I know what I was thinking. Big old Maggie, she's often your renal failure patients, but we also learned this one in OB. You covered it in your OB lecture. It's from too much of your magnesium sulfate. So, you need to watch for that. And remember, you're too much high. That's the ones that you use to treatment for the preeclampsia, and so you give them the mag sulfate. But then what happens if they have too much? What's those signs and symptoms? Well, you're going to have your lethargy, you're going to have your drowsiness, all of a sudden they're going to have nausea, vomiting, flushing, and before the flushing, they're going to have you're going to watch for those decreased detention reflexes, because what happens right after that? They could start seizing. So you're going to put those bed rails up. You're going to stop that mag sulfate. Okay, so there's your hypermagnesemia. So you're gonna pull off that by giving him IV calcium chloride or calcium gluconate to kind of offset that. And if they're a dialysis patient, you might need, if they're a renal patient, you might have to have dialysis to help pull it off. As a nurse, you're going to look for those signs that we just talked about, and you're going to look for those decreased deep tendon reflexes, and that's for your your big Maggie that has preeclampsia. Your hypo Maggie, which is your smaller Maggie, well, again, she's an alcoholic. She's a real mess, because not only is she an alcoholic, your little Maggie, she has uncontrollable diabetes, she has diarrhea and vomiting, so it's coming out both ends. She has prolonged malnutrition. She's little Kathy's friend. So she's going to be confused. She's going to have increased deep tendon reflexes, tremors, often accompanying alcoholism, seizures, again, which is the same with the hyper. Your treatment is going to be what? No, wait. Do they have? Yeah. Okay. All right. I'm square. So your treatment's going to be what? Your treatment's going to be if they don't have enough, you're going to give it to them. So you may give them the magnesium replacement, but you need to watch it that they don't end up going the other way. You're going to have seizure precautions. Safety related to confusion is going to be one thing that you're going to look for. You're going to tell them to eat those green leafy vegetables and nuts and bananas and things to put them back in their diet. You're going to tell her to quit drinking. You're always going to tell them to quit drinking. Let's see. Your hyperchloremia. I don't remember. Your hyperchloremia, well, your causes, this is rare, from aspirin ingestion, and it's a bicarb deficiency. They're going to breathe fast. They're going to have hypertension. Because they're going to be breathing fast, they're going to have decreased carbon oxide. They may have a headache, lethargy, hypovolemic, hypernatremia. Your nursing vital signs, your nursing interventions are going to be your vital signs, your ABG blood values. You're going to assess their neurofunction, kind of keep them on their toes. You're going to increase the blood pH and increase the HCO3 level. You're going to monitor their level of consciousness and their respiratory status. Your hypochloremia is going to be your hypochloremia, well, that's going to be, I didn't come up with anything real profound on this one either. Your hypochloremia, you're just going to have your diabetes, your profuse sweating are going to be the cause. You're going to sweat all that chloride out. It's probably, I think I was kind of just thinking that, with the hypochloremia, you're going to sweat that chloride out. It's caused from sweating profusely. They're going to have diarrhea. They're going to have excessive GI suction. They could be caused from let me say it again. Hypochloremia can be caused by excessive GI suctioning and vomiting. So they're vomiting too much. You might try to suction them. You suction too much. Then they're sweating like a pig. Anyway, they just don't have enough chlorine. It's depleted. Signs and symptoms are they're going to hypoventilate. They're not going to hardly be breathing because they're going to just feel like crap. They may be confused, and they can go into convulsions. How you're going to treat it? Well, you're going to treat the symptoms first. You're going to treat your nausea and your vomiting and your diarrhea. And then you're going to give him something salty. You're going to replace that chlorine that he sweated out. So you're going to give him something salty. you're going to monitor those lights and his level of function and his respiratory status, and you're going to encourage sodium in his diet. For chloremia. Did we already talk about hyper? Yeah, but for hyper, you're gonna want to tell them to limit that sodium in their diet. But your hyperchloremia, you want to encourage that.